Hello, my name is Nelson Vergel, and I'm here to discuss testosterone replacement therapy. I'm the author of a book, Testosterone: A Man's Guide, available on Amazon.com and testosteronewisdom.com. My main goal today is to bring you guys up to speed on the main mistakes that you can avoid doing. I've been on testosterone for 20 years, and I've been moderating large internet groups and met a lot of people through my lectures around the country. And it really surprises me and amazes me that so many men out there are still making really bad mistakes when using testosterone replacement therapy. Most doctors are doing a really good job, but many doctors are not following patients the way I think they should be followed. So this short lecture, hopefully less than 15 minutes, will teach you, if you're going to start testosterone replacement, what you have to look for to provide yourself, some protection against any side effects, and what questions to ask your doctor about testing and monitoring. So first of all, testosterone is a male-related hormone that is responsible for the male sexual characteristics, facial hair, deepening of the voice, but females also have it at a very low concentration. Their ovaries of women produce testosterone also, because testosterone is important for both males and females to increase or keep lean body mass, keep healthy bone density, mental capacity and focus, and sex drive. So both females and males have it. We have a lot more testosterone, obviously, in our blood than females do and women do. Testosterone is produced by the testicles in men and by ovaries and the adrenal glands in women. And some of us may have low testosterone early on in our 20s, 30s, and as we age, obviously, testosterone goes down due to aging-related issues. Some of us may be going through health issues, or HIV or cancer, or other conditions that may actually decrease testosterone. Some medications may decrease testosterone also. So it could be, low testosterone could be caused by several issues. Could also be caused by the way your glands are aligned with each other. If you're not talking to each other, the hypothalamus, the pituitary, and the testicular axis is not really working well. So only a doctor can tell you whether or not, what's the main cause of your testosterone problem. And the best way to find out if you have low testosterone is to test your blood for the hormone. And there are two different tests. One is total testosterone, and another one is free testosterone. Total basically includes the entire amount of hormone in your bloodstream, and free, it's the amount of testosterone it's actually doing the work on your muscles, your sexual function, your brain function, your bone density. But most of the testosterone gets bound by what we call sex hormone binding globulin. It's basically a globulin that grabs the testosterone, does not allow it to do the work. And there's another protein called albumin that also grabs the testosterone and releases it slowly as we need it. Only 2% of the total testosterone, around 2%, is free testosterone, which is really the main part of testosterone that does the job. So it's important to measure total and free. Some doctors only measure total, but make sure you get those two measured. Sex hormone binding globulin, this thing that grabs onto testosterone and does not let it do its job, increases as we age, increases if you're getting fatter. The fatter you are, the more sex hormone binding globulin you may have. If your thyroid is not working well, if you have diabetes, if you have kidney disorders of some kind, if you have cirrhosis or liver issues, if you use medications like anticonvulsants, even some HIV infection and some HIV medications can also cause increased sex hormone binding globulin. So as we age, testosterone goes down, total and free obviously, and sex hormone binding globulin actually goes up. So not only testosterone production goes down, but actually the protein that grabs onto it and holds it hostage also increases. So we have, from both sides, we have that issue. And as we age, we lose bone density, we lose lean body mass, we get fatter, We lose mental capacity, sex drive, obviously, erectile function. And some people believe, and I think it's becoming more mainstream, that providing testosterone, normalizing testosterone to youthful levels to older men may help them age more healthy and feel better. Feel better. Other doctors think it's a risky thing to do for older men, so there's a controversy. And the main controversy comes from people thinking, or doctors thinking, that testosterone can cause prostate cancer. And testosterone, when you give testosterone to somebody with prostate cancer, the cancer can get worse. But testosterone itself does not cause the cancer. So it is important for a doctor to check your prostate and do a PSA test, prostatic specific antigen, and other tests to find out whether or not you are cancer-free before you start testosterone. Especially as we get older, the incidence of prostatic cancer is definitely much worse. So it's important to do that, because you don't want to have to start testosterone if you have low testosterone, if you have prostatic cancer. So, and if you do start testosterone and you have low testosterone, the first benefits is increase in sexual function. If you don't feel more sexual, there's definitely something going on. You're either not having enough testosterone in your system, or you're not applying it well, or you are not using the right product for you. There are many types of products. There are injectables, which are usually the cheapest, cypionate, testosterone enanthate. There's a new product coming through soon called Avid, which is a long-acting injectable. There are gels like Androgel, Testem, Axiron, and others, and compounded gels that you can apply on your abdominal area on your body, and testosterone gets absorbed through the skin. And there are pellets that the doctors put under your skin. And there is also an underarm lotion, a patch, another patch that you put in the vocal, in the mouth, in the gum area. And they're working on a nasal spray. So there are lots of options. And it's kind of hard sometimes to find out which option is the best for you. Many doctors start you with a gel, because you can do it yourself at home once a day after you take a shower. Some people don't feel anything, or don't feel that much better on a gel, even though the testosterone goes up, and the doctor switches then to an injection once a week. 100 milligrams or so is a typical dose. And some men that are too busy to inject or to use gels, and they want to do something every 3 months, they have doctors insert pellets, little tiny rice-sized pellets under their skin that release testosterone slowly. The product in the United States is called Testopel, and compounding pharmacies. These pharmacies actually make hormonal products for people, and you can find out more about that on my website and my book. Also make pellets and gels and injections. Fortesta is another gel too that is a little bit of a higher concentration gel. So it is hard. It is hard to find out which product to use first. As I said, gels have become the #1 option first, because their simplicity, and they also keep your blood levels a lot more constant, a lot more physiological, unlike injections, which can, of course, increase, and then you have a little bit of a roller coaster effect. As soon as you start testosterone, and within 3 to 4 weeks, you should definitely feel something different, like probably more sexual dreams, more desire, more energy, more focus. If you don't, then you have to talk to your doctor. Make sure your doctor retests your blood levels of testosterone, free and total, 6 to 8 weeks after you start, just to see where you are. Some men need more of an increased dose or frequency and whatever they're doing to reach levels. And where is a good level? Anywhere from 500 nanograms per deciliter to 1100. Some doctors want to see you on 700, and it depends on everybody, but anywhere from 500 to 1100. One thing that not a single doctor, very few doctors, I shouldn't say not a single doctor, because I would get great. Very few doctors are warning their patients about is the fact that once you start testosterone, injections or gels or whatever, your own testosterone production, your own testicles are going to stop producing testosterone. Yes, you started testosterone because you had low testosterone production. So, but you still had some. Some of us still have some testosterone production. That's completely shut down after you start testosterone. And some, I'm amazed that some men don't know that. They think we're supplementing on top of what they're producing. No, we're not supplementing. We're replacing. That's what's called testosterone replacement therapy. I don't think we should be saying testosterone supplementation because we're not supplementing. We're replacing. And when that happens, basically, we have three glands. We have the hypothalamus, and two actually in the brain, and the pituitary gland, the mother glands. They talk to each other, and pituitary gland actually sends a signal, two signals, LH and FSH, two hormones, to the testicles to make them produce testosterone. When we use testosterone, that axis, that communication stops. So there's no LH, no FSH. Testicles tend to shrink. Not, don't be too worried. Most of the time they don't shrink all the way, but they do shrink, and some men feel a little self-conscious about that. And there's another product you can use called HCG, human chorionic gonadotropin, that makes your testicles return to normal size. And there's a really detailed protocol in my book that would take too much to explain on a video like this. I want to keep this short. So make sure you know, there is a commitment. Once you start testosterone, when you get off testosterone, let's say you just decide to get off, your hormonal axis is going to be pretty much shut down for a while. So you're going to feel all the symptoms you had at the beginning, probably even worse, for a few weeks. And hopefully one day you'll be producing testosterone again. It may or may not return to normal because most of us were not normal to start with. Something else. This is a really important thing that also I see very few patients being aware of. It's the fact that testosterone can convert into estradiol, an estrogen, a female hormone. And it does, and we need estradiol. Men need estradiol for to provide to improve bone health, cognitive health, hair and skin health. So men, we need estradiol. We need a female hormone, just like women need testosterone too, in a small concentration. But testosterone can convert into estradiol, and in some men, a lot of estradiol conversion that can cause increase in breast size, which is called gynecomastia, increase in fat mass, increase in water retention. There's some studies that say that higher estradiol can also cause more moodiness. So it is important to also test your estradiol blood levels before you start testosterone and after a few weeks after you start the therapy, just to see if you're unfortunately one of those men that have really high estradiols over 30 picograms per deciliter. And unfortunately, many doctors don't test for estradiol. And once they do test and estradiol comes back high, they don't know what to do about it. There are estradiol blockers or aromatase inhibitors, basically an inhibitor that inhibits the enzyme that makes that conversion of testosterone to estradiol happen, like Arimidex or tamoxifen, we call anastrozole as Arimidex, that can block that estradiol conversion. But you have to be careful. You don't want to block it all the way because we need estradiol to keep healthy bones and many other benefits. So that's another thing that I'm seeing a lot of problems with, that many doctors don't know how to use the drug. The drug is actually not approved for men, but it is used off-label. So make sure, especially if you're having pain and swelling around the breast area, that's almost a sure sign that you have high estradiol. And you cannot let it go for too long because it cannot be reversed after a certain point. You will have to get surgery to get, but that's rare. That happens more at the higher doses of testosterone that bodybuilders use. But some men, especially as we get older, we tend to also have that problem even at the lower doses of testosterone. Testosterone replacement injections, for instance, the normal dose is 100 milligrams per week. Bodybuilders sometimes use 1,000, 2,000 milligrams per week of testosterone to bodybuild because it really builds muscle. But so we hear a lot of the horrible things of testosterone from experiences from the bodybuilding community, which I'm a bodybuilder myself. So I thank them for all the knowledge they provided us. But a lot of those huge side effects come from higher doses of testosterone. So keep that in mind. And estradiol can also, the conversion of testosterone into estradiol can also be worsened by medications. And some HIV medications have been shown to increase estradiol. Prednisone, glucocorticosteroids, antibiotics, antacids like Tagamet, some chemotherapy, et cetera, et cetera. There are digitalis, calcium channel blockers, definitely anabolic steroids, excessive alcohol consumption, excessive marijuana smoking can also increase estradiol, heroin. Even there's some studies that show that soy-based products for men can increase estradiol. There's some controversy there, but you have to be very careful. Pesticides exposure, some studies have also shown that men exposed to pesticides have high estradiol. So there are many reasons why estradiol may be high, but it's important to remind your doctor week 6 to week 8 to get you tested for free total testosterone, estradiol, and probably other tests like PSA testing and hematocrit. I'm going to speak about red blood cells and hematocrit now. That's another thing that I'm really concerned about. Testosterone is a hormone that actually enhances the production of red blood cells, which is a good thing if you have anemia and if you're tired because your red blood cells and your hemoglobin is low. So it actually enhances that, and that's a good thing. But in some men, and it's a very small proportion of men, testosterone, even at low doses, can have enhanced too much red blood cell production. And the proportion of blood volume that red cells occupy is called hematocrit. And as we have more and more red blood cells, our blood can get thicker and viscous, and we are going to have a lot more problems having our heart pumping all that thick blood. It's called polycythemia, that problem. And that's not good. I mean, you may feel better, you may feel great, you may have more sexual drive, but your cardiovascular risks are definitely going to be higher. The only way to find out where you are is to measure your hematocrit or your hemoglobin blood levels, either one. And most doctors are actually doing that, following that up. If you have high hematocrit, if your hematocrit goes above 51, for instance, that's when it gets tricky, because most doctors get really scared of that and want you to stop testosterone. Now, of course, what happens when you stop? You feel horrible again. And so another more reasonable option is to have blood drawn so that your viscosity goes down and your red blood cells go down. That's a therapeutic phlebotomy. And believe it or not every doctor actually provides that basically you have to get a prescription and order from a doctor to get blood drawn, 3 units, or so every 3 months or so in some cases. But as I said, not everybody has that problem. Most people do not have huge increases in hematocrit. Everybody's hematocrit goes up, but very few men have it over 50, over 52. And the testicular atrophy thing that I talked about, that's the most concerning thing for some men. So, well, I feel great, but my testicles are smaller. The penis does not get smaller, by the way, so that's something I want to clarify. Some people ask me if it's true that bodybuilders' penis shrink. No, that's not true. Testosterone or anabolic don't cause that. Your testicles do shrink, but luckily you can reverse that. You can make them grow again with something called human chorionic gonadotropin, or HCG, and it's an injectable under the skin. And you can find out all the details on my book. I have pages of HCG information. You can get HCG through a prescription by ordering it through a compounding pharmacy. Like I use apsmeds.com, apsmeds.com. They have very good prices on testosterone replacement, on injections, gels, pellets, HCG, and many other products like even sublingual Viagra and other things too. So let's go back to really finally the last part I want to talk about is the prostate. Testosterone does not cause prostatic cancer. If you have prostatic cancer, testosterone, you cannot use testosterone because it can fuel that cancer. Clear as that. What it gets tricky is how to monitor men. How many times do you check PSA test on men on testosterone every year? I think it's a reasonable thing to do. A digital exam. Many doctors forget to do a digital exam at baseline and 6 months and a year, just to make sure. If you're going, not only cancer, but testosterone can also increase the volume of the prostate. And if you see yourself getting up more than once a night to pee, or you're not voiding really well when you're peeing, you may have an enlarged prostate too. And testosterone may actually increase prostatic hyperplasia or enlargement, which is not cancer, it's just benign. So you have to make sure you talk to your doctor about. That's my main question. I ask guys. I do consultations, by the way. You can actually set them up on testosteronewisdom.com. I ask guys, how many times are you getting up at night? Are you peeing a lot at night? Because we think we need to pee, but it really is our prostates are so enlarged that we're not voiding completely. And there are medications you can take for that, by the way, that can decrease the inflammation. So just make sure you get your prostate checked at least once a year to make sure you're not one of those that unfortunately will have to stop testosterone if you have a prostatic cancer. And the only way to find out if you have cancer is to basically biopsy, and that's not fun either. The last but not least, acne. Some people have acne in the back, kind of rare, but if you had acne when you were a child, you're probably going to have some acne with testosterone replacement. Just making sure you wash yourself very well after the gym, after you sweat, and get some sun once in a while. But that is not a huge problem. So as I said, remind your doctor that you need to get retested every 6 to 8 weeks. Free and total testosterone, estradiol, hematocrit, prostatic. Depends on where you are. If you're younger, maybe a PSA test every year or so. If you're older, maybe more frequently. There are no agreements. There are 4 guidelines, medical groups that have different guidelines, and none of them agree on the frequency of testing of any of these variables. So unfortunately, we don't have complete agreement, but it depends on what the doctor actually believes in most cases. Also remember that you can get all the testosterone. Testosterone can only be obtained by prescription. Yes, you can probably buy testosterone online. That's actually legal. Those supplements, most testosterone replacement, all of them, supplements, most of them are scam. They may increase testosterone for a few hours, but some of them are liver toxic. Some of them have Viagra without telling you. Actually, the FDA has caught a few companies that import Viagra from China and put it in supplements to make people think, oh, I'm feeling more sexual, so I have better erection. It must be a testosterone booster. So be very careful. The safest way to use testosterone is by prescription, having your doctor monitoring it, testing your blood to make sure you're okay, and not using underground testosterone or some supplements that are going to take your money and basically rip you off and even injure you with liver toxicity or scam like that. You can get, as I said, many products. Testing, Androgel, their gels, Fortesta, Axiron, Testopel, testosterone cypionate, NF8 injections, and you can get most of them too if you don't have insurance, and you don't have, they're costly if you don't have insurance. You can get them really cheap without insurance, paying your own money through compounding pharmacies. And you can find out the closest compounding pharmacy to your location by Googling compounding pharmacy and the name of your city. I use a national one that ships everywhere called apsmeds.com. I've probably worked with 25 compounding pharmacies in my experience, and they have really good quality control, and the prices cannot really be beat. So just tell them that I sent you. Once again, find all this information and more in my book, Testosterone: A Man's Guide, and my website, testosteronewisdom.com. I have a blog that I blog, and also I have a Facebook group, a very good Facebook group called Testosterone Replacement Discussion. So thanks a lot for joining me, and stay tuned for other videos that I will be making on exercise, nutrition, and supplementation. Thank you.